Preparing for retinal surgery. This informational slideshow will provide you basic information to understand what to expect before, during, and after retinal surgery. We will also answer common questions related to surgery and surgery scheduling. Retina surgery is performed in an operating room under local anesthesia. You will be awake, but given medicine so that you are drowsy and pain-free. You will come 2 hours before surgery and stay approximately 1 hour after surgery before going home. There is no need to stay in the hospital overnight. You will have postoperative appointments the day after surgery, approximately 1 to 2 weeks after surgery, and again 1 month after surgery. Scheduling surgery can seem like a complicated and confusing process. Rest assured, we have a dedicated team of surgery coordinators who are kind and knowledgeable who will help you through it. How long your surgery may take depends on the type of surgery you are having. Most retinal surgeries take between 30 minutes and 1.5 hours. In some emergency cases, a surgeon other than the doctor who saw you in the clinic may need to perform the surgery. If your surgery is not an emergency, you may be asked to see your regular primary care doctor for a preoperative evaluation. Laboratory testing may be performed as needed. Your primary care doctor or eye doctor will decide if you can stop your aspirin, Coumadin, or Plavix for a week before surgery. Our surgery coordinators will call you 1 to 2 days before surgery to let you know what time to come to the surgery center. Do not eat or drink anything after midnight the evening before your surgery. If you take medications in the morning, for example blood pressure pills, you may take them with a sip of water. Nothing else, only water. On the day of your surgery, you should arrive at the surgery center 2 hours before your scheduled time. Please be available by telephone at all times on the day of your surgery, in case we should need to call you to move your surgery earlier or later to accommodate other emergencies or unforeseen events. You will need someone to pick you up and take you home after your surgery. You should not wear makeup or jewelry on the day of your surgery. Please leave all of your valuables at home. You should bring your insurance cards and a valid identification, for example a driver's license, for registration. Prior to your surgery, your anesthesiologist will give you medicine through your IV to make you more relaxed. Your eye will be anesthetized with a local anesthetic, and you will still be awake throughout the surgery, but you will be comfortable and pain-free. After your surgery, in the postoperative recovery area, you will be given something to eat and drink. Your postoperative instructions and appointment will be given to you, and you will be able to leave about 30 minutes to an hour after surgery when you are comfortable and the nurses have decided that it's safe for you to return home. The first night after your surgery, you should keep the patch and shield on overnight. You may have some mild to moderate pain or discomfort after the local anesthetic wears off. You may feel nauseated. If you are having very severe pain or severe nausea, you should contact the office or ask to speak with the doctor on call. On the morning after your surgery, you may remove your patch and shield. You do not need to replace the patch or keep your eye closed. You may use a clean, warm washcloth to gently wipe away any crust and gently separate the eyelids. You may wash your face and shower normally. You should begin using your postoperative eye drops as soon as you remove the patch. If you take drops for glaucoma, you should restart them the day after your surgery. Bring all of your drops to your postoperative visit. On the first day after your surgery, you should expect to see dried blood on your eye patch. You may have bloody tears, and swollen and bruised eyelids are normal. You will have sensitivity to light, and soreness, pain, and irritation of the eye are common. Your vision will be very blurry and often worse than before your surgery on this day. This is normal and temporary. 1 week after your surgery, the eye may still be red or bruised. The irritation and scratchiness may still persist. The vision may start to improve at this point, but slowly. If a gas bubble was used during your surgery, you may start to notice it getting smaller. While your eye is healing after surgery, you may see flashes of light or floaters. A bouncing shadow or colors may be present if you have a gas bubble. You may have double vision. If any of these symptoms are severe, you should contact us at the office. Several months after surgery, the eye should have a more or less normal appearance. The eye should not be painful. The vision will have slowly improved after surgery and stabilized. And now for some frequently asked questions. Can I fly or return to the mountains after surgery? If a gas bubble was put in your eye, do not fly or travel to any altitude over 500 feet without discussing this with your surgeon. What can I take for pain? Most patients take 1 to 2 Tylenol tablets every 4 hours. Do not take more than 8 tablets over a 24-hour time period. You can use 1 to 2 ibuprofen tablets every 6 hours if you cannot tolerate Tylenol. Ice packs, or improvised ice packs such as a bag of peas, can also be used on the area of the surgery to provide more comfort. What can I do to improve my chances after surgery? You should come to all of your follow-up visits to be sure that you're healing properly and that no additional treatment is required. You should follow all of your post-operative positioning instructions, and you must use your post-operative drops as directed.
What are my restrictions after surgery? You should take 1 to 2 weeks off of work. We ask that you avoid strenuous exercise for 2 weeks. Do not bend over for 2 weeks, and avoid lifting anything over 10 pounds for 2 weeks. You should not wear contact lenses for at least 1 month after surgery.
Well, what can I do? Aside from the restrictions mentioned in the previous slide, most patients can continue with their normal daily lives. You certainly may read, watch TV, or go for a light walk. My eye is red. How long will this last? It may take a month or more before the eye begins to look more or less normal. You will have times when the eye may look more red and times when it looks less red. This is common and normal after surgery. My eye is scratchy. Is that okay? Irritation is normal and will get better in a few weeks. Stitches used during your surgery will dissolve on their own within approximately 6 weeks, and they do not need to be removed. We encourage you to use over-the-counter artificial tears for minor irritation. When will my vision get better? The vision is often temporarily worse after surgery, and vision recovery after retinal surgery is a very gradual process. It may take several months for the retina to heal and for you to attain your best vision after retinal surgery. The long-term prognosis for your vision will depend upon the type of surgery that you had and the type of problem that you have in your retina. When can I get new glasses? You will usually need to wait 3 to 6 months after your surgery before obtaining new refraction for glasses. Your surgeon will let you know when glasses may be helpful. Will I get a cataract after surgery? Retinal surgery usually causes your cataract to get worse. You may need cataract surgery within several months to years after retinal surgery.
If you have any other questions about your surgery, please call before the day of your surgery to have your questions answered before coming to the surgery center. Appendices. How to put in your eye drops. Only 1 drop of each medicine is necessary. Pull down on your lower eyelid and place the drop in the pocket that forms between your lower eyelid and your eyeball. Wait 2 to 3 minutes between administering different drops. Always put drops in before any ointment.
The following are some common surgery terms. Vitrectomy. A vitrectomy is the removal of the jelly that fills your eye using tiny microsurgical instruments. Sclerobuckle. A scleral buckle is a permanent silicone band that is placed around your eye to support the retina. Cryotherapy. Cryotherapy is a freezing treatment used to treat retinal tears. Membranectomy. A membranectomy is when tiny forceps are used to remove scar tissue from the surface of the retina. Gas bubble. A gas bubble may be used for retinal detachment or macular hole surgery. Most gas bubbles require special positioning for 5 to 7 days after surgery. The gas bubble will get smaller and disappear over a few weeks. The vision will be very blurry until the gas bubble goes away. With a gas bubble in your eye, you must not travel to an altitude greater than 500 feet or fly in an airplane without the approval of your surgeon. Doing so may result in permanent and irreversible vision loss. Silicone oil. Silicone oil may be used for retinal detachment or macular hole surgery as well. This still requires face-down positioning for 1 to 2 days after surgery. After the first few days, no special positioning is required, although we do ask that people do not sleep on their back. Unlike gas, the oil does not go away on its own and must be removed surgically months after the initial surgery. The following are some common retinal conditions that require surgical management. Retinal detachment. Retinal detachments can be repaired either with a scleral buckle using cryotherapy with or without a gas bubble, or by using a vitrectomy with gas bubble or oil. A scleral buckle and vitrectomy are sometimes combined with gas bubble or oil placement to repair retinal detachment. A vitreous hemorrhage is often treated with a vitrectomy with laser at the time of surgery. Sometimes a gas bubble is necessary. An epiretinal membrane or macular pucker is treated with a vitrectomy and membranectomy. A macular hole is treated with a vitrectomy and membranectomy with the addition of a gas bubble or silicone oil.